Gentleman from Maryland is recognized for 2 minutes.
Thank you very much, and I thank the gentleman for yielding the time. Madam Speaker, I rise a concern about H.R. 6087, Improving Access to Workmen's Comp for Injured Federal Workers Act. You know, it was mentioned that it's fine if people are qualified, if health care practitioners are qualified to deliver workmen's comp. Certainly, in some states, nurse practitioners and physician assistants, nurse practitioners specifically can practice without a physician oversight. But the question is whether that's appropriate for workmen's compensation. Remember, workmen's compensation includes people who have been injured or have claimed to have been injured on the job. These individuals, these employees deserve the highest level of care, the highest level of evaluation, of diagnosis, certification, and treatment. And what this bill does is turns over the qualifications for who is going to treat those injured federal workers to the state to make the decision. Because it says, well, if in a state they decide that a physician assistant practicing independently is just fine, well, that federal worker is not going to have the benefit of having a physician involved in that care. Madam Speaker, this is a serious policy debate. This debate actually should be taking place, I believe, not on a suspension calendar, but actually coming under a regular rule and be debated for whether or not this is the way we want to treat federal employees. We want to subject them to a state level of care as opposed to a level of care that we think is appropriate, again, for an injured federal worker. So, Madam Speaker, I ask without objection to enter the letter from the American Medical Association, quote, strongly opposing H.R. 6087. And they give
without
a variety
objection, so ordered.
Thank you very much. They give reasons. They say, look, education matters. Patients want physicians involved in their diagnosis and treatment decision. I think that's true. They say that increasing the scope of practice of nurse practitioners and physician assistants can lead to increased health care costs, but specifically mentioning the fact that there are studies now that show that when a nurse practitioner is involved or a physician
Gentleman's
assistant—
time has expired.
I'd like to have 30 more seconds.
30 seconds.
Gentleman is recognized for 30 seconds.
Thank you. They mentioned that, for instance, opioid overprescribing occurs 4 times as much when a nurse practitioner is involved. Obviously, in a workman's comp case where injury may be determined, this could be significant. This should be something we should deal with. And finally, even the AMA recognized that they're concerned that we're attempting to pass this under suspension of the rules, usually typically reserved for non-controversial bills. Again, Madam Speaker, I thank the gentleman for time. I thank the Speaker, and I yield back the balance of my time.